Namaste. This is Dr. Vaishali Ashok Bhide, MD Homeopathy. Today we will be talking about insomnia. So, insomnia in simple terms means inability to have a quality sleep. So, here the person may find it difficult to fall asleep, or sometimes they will get up in the middle of the night and then are unable to sleep. So, basically, they are not getting regular sleep and they wake up unrefreshed. The incidence of insomnia is at its all-time high in the last 5 years. Around 23 crore people around the world are grappling with this problem. 10 to 30% of population, usually in each country, is battling with insomnia. Unfortunately, in a few countries, this proportion is as high as 50 to 60%. In practice today, we have to differentiate this lack of sleep in two ways. One, which is we diagnose as insomnia, where the person is trying to fall asleep but unable to sleep. Here, we give them homeopathic medicines. And there is a second group, which is the result of unfortunate life choices. That is, people who do not want to sleep because they are glued to their gadgets and their social media. So they choose not to sleep. So this population requires counseling and not medicine. As I said, this is not genuine insomnia. Insomnia is diagnosed when you are trying to sleep but yet you are unable to get quality sleep. So what are the causes of insomnia? Causes of insomnia are broadly divided into two types: primary and secondary. Primary, as the name suggests, it's primary insomnia. That is, it is not because of any medical condition or any psychological upset or a psychiatric illness. This is usually seen in people who think a lot or who get very nervous before exams or before any event. Such people find it difficult to sleep. Here we label it as primary insomnia. The second group is secondary insomnia. Here, as the name suggests, the insomnia is secondary to certain conditions. For example, if there is a sudden change of work, working in night shifts, sudden change of occupation, extremes of temperature, these can result in the person losing long-term sleep. Second is psychological upsets like battling with anxiety, depression, other mood disorders, or a sudden tragic turn of events in their life. Thirdly, blood pressure. Diseases like blood pressure, diabetes, thyroid disorders, other endocrine disorders also come with insomnia as their primary symptoms. For example, when a patient comes to us and tells us that he is losing sleep and is unable to sleep since the last 3-4 months, we first check their blood pressure because sometimes this is the initial sign of high blood pressure. So there are these three causes of secondary insomnia. It is very important to note here that while we are saying here that blood pressure, heart condition, diabetes, thyroid disorder or other endocrine disorders will present or will have insomnia as a problem, at the same time, insomnia alone, which means if a person has not slept well for months together, that itself can put them at a risk of heart disease, diabetes, blood pressure. So it's a vice versa cycle. If you have these illnesses, then there is a high chance that you will get insomnia. And in case you have not been sleeping well for the last months or for a good amount of time, then you are at increased risk of all these illnesses. Insomnia, we sometimes also differentiate as acute and chronic. Whenever we label someone as acute insomnia, it means that their suffering is usually few days to few weeks, say less than 6 weeks. We label a person having chronic insomnia is when they have not slept for more than 3 days a week for more than 3 months. That is the time we label them as chronic insomnia. But before we get into the symptoms and the problems with insomnia and the treatment, let us first see why the sleep cycle is so important. Our body has a biological clock called as the circadian rhythm. This rhythm is the automatic clock inside the body which decides when you sleep, when you wake up, when you will release the enzymes required for digestion, when you release the enzymes required for absorption of nutrients, at the same time when your body will release certain hormones or certain neurotransmitters. So everything is automated and regulated, and sleep cycle is a very important part of this biological clock. So what happens is, when you keep your eyes open and the light falls on the retina sends a signal to the gland in the brain that eyes are open, we are not sleeping. Now, when you close your eyes and darkness is perceived, which means no light is falling on the retina for some time, in that case, your brain is now aware that you are trying to sleep. So the impulses will go from your hypothalamus. There are a bunch of neurons above the hypothalamus. They send the signals to the pineal gland, and the pineal gland will release melatonin. Melatonin is the hormone which gives us deep sleep, or induces or helps us get into deep sleep. This is the hormone which is found maximum in the blood during deep sleep. So this is how a simple process of light falling on the eye or not falling on the eye will give you a good or a bad sleep cycle. So let's see the stages of the sleep cycle. So once we have slept, there are 4 stages. Stage 1, 2 and 3, that is NREM. NREM stage 1, NREM stage 2 and NREM stage 3. This NREM stands for non-rapid eye movement, and for this REM stage 4. So in stage 1, that is NREM sleep, the person has just decided that he will go to sleep. This is the first 10 minutes of trying to sleep. Here, if you wake up that person, he has not realized that he has gone to sleep. It is that early stage. Here he is responsive to all the sounds that are coming around him. After the first 10 minutes, if they are undisturbed, they go into the second stage of sleep, that is NREM 2. Here, the breathing has become more regular, more slower, heart rate has dropped a bit, the temperature is dropping, the movement of the eyes have reduced, slowly and surely the body is relaxing. This stage lasts for about 1 to 1.5 hours, following which is the third stage, that is NREM 3. This is the stage of deep sleep. In this stage, maximum melatonin is found in the body. The importance of this stage is, your breathing is also settled here, your body is relaxed, your heart rate has dropped, your temperature has dropped, and your body is going in deep sleep. At this time, growth hormone is released, which is very vital for the growth of the body, and most important in case of growing children. That is why we always encourage them to sleep well. In this stage 3, the body or the brain will check for tissue repair, which means the repair of the tissue and immunity modulation. What needs to be corrected in the body is assessed, and body takes action in this stage of sleep. This is also the stage of sleep where your memory is packaging the information that you have collected in the day and storing it in different places. So this is a very important stage of sleep. When you go through this stage, then you go into the next stage, that is REM stage, that is stage 4. REM stands for rapid eye movement, wherein the brain becomes active. Eyes will move, but your body relaxes further, and this is the time you will see your dreams. So this is how a person goes into deep sleep and slowly wakes up in the reverse order. Here it is important to note that in the deep sleep, the growth hormone was released and body's tissue repair was done. So when we are not having good sleep, we are not able to repair, or tissue repair in the body suffers. Usually when we are not sleeping well, what happens is, when we get up in the morning, we are not very active and focused. So the body realizes, the brain realizes that it's time for work, but we are not being so active. So it increases the release of stress hormone cortisol to help us match up with the demands of the day. What happens is, over a prolonged period, as more and more stress hormone is released to cope up with the day, The side effect or the effect of this hormone on the body is weight gain. So people who sleep less or who have insomnia will start looking more fat and they will have black patches on their skin. This is result of the stress hormone. So when we treat them for insomnia and they start sleeping better, they also tend to lose weight faster and their skin becomes naturally glowing again. So let's see what is the treatment of insomnia. Before we go to the treatment, we'll see the sign and symptoms of insomnia. So in a normal person, in the short run, insomnia will affect the memory and concentration. However, in the long run, it will cause problems with hormones, tissue repair, wound healing, metabolism, digestion. You may have digestive difficulties once you have not slept well for a long time. Cardiac problems, blood pressure, diabetes, all this becomes an increased risk. In children, if they have this problem, what commonly occurs is there will be increased irritability, lack of concentration, poor memory, poor motivation or learning skills, and they will see that many times they are not able to cope up in school and you will start getting complaints from the teacher that they are unattentive. So this is the common things a person will experience if they are not having a good sleep cycle. So let's further go to the treatment of insomnia. In homeopathy, as always, we will take a detailed case to know the exact cause why they are not sleeping well. For example, I'll give examples for this. We had a lady, 60-year-old, who was suffering from insomnia for 8 months. She was a diabetic for 15 years, which means her diabetes directly did not affect her sleep for a long time. However, since 8 months she was having difficulty in sleeping and she would sleep only for 1 to 2 hours in the night. So while taking the case, we probed further and we realized that she had lost her only son to a train accident. And after that, she had lost her sleep. Every night while she would go to bed to sleep, she would just think of the ways he met with that accident, why it happened, how it happened, why God did what he did. And these thoughts would not allow her to sleep and she would be crying the whole night. So in her case, we have taken the reason for insomnia being bereavement and grief. And medicine was selected accordingly. And she responded very well. And after 3 months of treatment, she started sleeping well and her blood sugar also showed improvement. I'll share a second case. This case is of a child who is in 7th standard then, that is a 13-year-old child. The mother got the girl to us for treatment because she was having grey hair at the age of 13. While taking the full detail, we realized that she has not been sleeping well for the last 8-10 months again. So on probing further, we come to know the story that this child is the only child. So she was very pampered. She was very intelligent. So in the school, she was always a ranker. But in this standard, just the earlier standard, she lost her rank, her first rank, and she came third. That affected her so much because she did not get any praise. She did not get any accolades. And every night while she would sleep, she would think about it and she would be very jealous of the people who have come first and second. Accordingly, she would just make up theories how she would do something so that they would not get the rank again. And she was very frank while telling us this, that every time I see them, I feel very jealous that they are getting all the appreciation. So in her case, when we had to treat her, we took jealousy as the main element which caused her insomnia, and a medicine was selected accordingly. And she did much better. The color of the hair improved, plus she started sleeping well. We talked that growth hormone is released during deep sleep, so it is very important for these kids to be sleeping well. I had a third case, a similar case, where this person does intraday trading, which means that he is glued to the numbers for good 8 to 10 hours. What happens is when he is trying to sleep in the night, he will still keep seeing numbers in front of his eyes. If he says, I close my eyes, I still keep seeing numbers. And I dream about the numbers the entire night. And I remain restless. I keep tossing and turning in bed only to realize that I'm not actually working on my PC, I'm sleeping. So when he gets up in the morning, he feels as if he has worked the whole night. So in his case, when we see such a case, the medicine that was selected was the one which comes with brain tire, seeing too much of numbers with restlessness of the nerves and restlessness of the body. A different medicine was selected and prescribed. Here also he responded much earlier to treatment than we expected, and he no longer has this problem. Here with these three cases, we have seen that with the common problem of insomnia, by seeing the reason why insomnia started in these people, we gave very different medicines to get similar good results. Hence, the depth of case taking is very important for a homeopathic doctor, because that decides the medicine that we will give. Apart from homeopathic medicine, there are a few things we request or suggest them to follow. Those are the lifestyle modification. The first and the most important, which we all know, is not to see your mobile screens or your TV screens or any gadgets 1 hour or 15 minutes minimum prior to sleeping, because if that light falls on the eye, then the brain knows that you are awake and it will not release the hormones which will help you induce a good sleep. Avoiding coffee and alcohol in the night, as caffeine acts as an excitatory enzyme and it will not prevent deep sleep. Similarly, avoiding late night food or heavy food or acidic food, because acidity issues will again not allow you to sleep well. I always encourage them to do pranayam even while sleeping in their bed, which will help them regularize their breathing, and the body will relax and the mind will be relaxed and they will get good sleep. So these are a few things they have to follow so that they can get their share of good sleep. I am currently practicing in Dadar West, Shivaji Park area. My clinic timings are afternoon 1 to evening 7 p.m. On Mondays, Wednesdays and Fridays, I practice at Park Polyclinic 5 Shankar Nivas, Dada Saheb Rege Marg, right opposite Shiv Sena Bhavan. And on Tuesdays, Thursdays and Saturdays, I practice at Sapley's Polyclinic, Malik Building, DV Deshpande Marg, Shivaji Park Road number 4. I have recently published a book titled Unlocking the Boger Synoptic Key. This book is on homeopathic medicine and it is available on Amazon. You can also follow me on Facebook, Instagram and YouTube. Thank you. Stay happy, stay blessed.